Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Welcome back, Turd Nerds, to another episode of the Turd Nerds. Today, Dr. Sand is going to lead us in a discussion for an herbal medicine that, in my experience, completely game changed treating ulcerative colitis. Completely game changed it. And very quickly, I just want to give a shout out to Dr. Mark Davis, who is a friend of mine, but also introduced me to this magical herb. Dr. Sand, tell us about this magical herb. What's the herb?
Well, so we're going to kind of go through some of the literature on this. We're going to go through some of the historical uses of this, and then maybe we'll just pop in about how we use it clinically.
Yeah.
Is anyone making this into a pharmaceutical?
Not yet, which I'm just waiting for them. Oh, are they?
They're extracts.
Oh, okay. What's the herb? We should tell them what the herb is.
Okay, so the powder we're talking about is in Chinese medicine Qing Dai. Indigo naturalis is sort of the extract that we call it, but it's actually from 3 plants. So we can extract it from 3 plants. Polygonum tinctorium.
I use that in Chinese medicine.
Yep. Isatis indigotica.
I use that in Chinese medicine.
Bathacanthus cusia.
I've
Never heard of that one.
I hadn't heard of.
Nope.
Used in different forms, I think. They have the same first part of the name, but maybe a different second part.
Like same genus.
Go ahead.
So a little history. Okay, some of us know this from traditional Chinese medicine. It's in the formulary. We all study it. And typically in Chinese medicine, we're combining herbs. The herbal lists are 26 herbs long per formula. We rarely use single herbs in Chinese medicine. So for sure, that's been documented for thousands and thousands of years in Chinese medicine. But they weren't the only ones to uncover this one. So it's been used in ancient China, ancient India, Egypt, and Africa. As at least a dye, because it's indigo, right?
Right, yeah.
But there may be some medicinal history there as well. And then it was sort of introduced to China and Japan, which is where a lot of our studies come out of, for a bunch of medical conditions. So
I was already confused by, so it can be extracted from those 3
into
plants?
the powder that we call indigo naturalis.
But that's different from what you're going to be talking about? That's the same?
Yep.
Okay, so it has to come from 3 other plants to form this compound.
Any of these 3 plants.
Any of these 3 have. So like berberine can be.
Yes.
Okay.
Totally.
Now I understand.
Yeah.
Thank you.
Yeah. I also was under the impression that it was one plant.
Yeah, so I was confused.
Indigo naturalis. That's interesting.
3.
Okay.
Yeah. So in Chinese medicine, and this might be kind of weird to people who haven't studied Chinese medicine, but it's a heat-clearing, toxin-resolving substance.
That makes sense.
So can we
Totally,
wait?
right?
No. Can we just explain how Chinese medicine views different plants' properties? Yeah. Okay. In China, whenever we're studying Chinese medicine and we're diagnosing a patient, it's, in Western medicine, where you have ulcerative colitis, you have Crohn's disease, you have psoriasis.
Yep.
In Chinese medicine, they take their cues from nature and they say that nature lives inside the body. So you might have a Western diagnosis of ulcerative colitis, but you might have spleen cold or spleen damp type of presentation,
right.
Or you might have heart fire warm type of presentation. So you're not choosing herbs or acupuncture points based on the Western disease. You're choosing it on the presentation of how that disease presents within your body.
So that's the way we can individualize care,
right,
for people with ulcerative colitis or something like
that. That's why we do.
Okay,
that is how we.
For people who have not studied Chinese medicine, is it also like a basic understanding? It's either a heat or a cold type of condition.
That's one way you can differentiate it, but there are many.
You can have heat, you can have cold, you can have damp, you can have dry, you can have
But if
phlegm.
it's like an acute
Stagnation.
inflammatory flare, isn't that kind of a particular category?
Not necessarily,
Okay.
Typically will be heat.
but not
That's what I
always. So
Diarrhea tends to be
but not always. But like a bloody diarrhea, and one of the things we'll talk about this
that
plant
would
in
be heat, right?
particular, a bloody diarrhea would be a hot diarrhea. And like a diarrhea that's just like falls out of you, like no pain, no urgency, just like falls out of you, that might be a cold presentation.
Like a C. diff, maybe.
Right.
Yeah, totally.
Okay. So that's Chinese medicine diagnosis 101.
Yeah,
Really.
it's a wild world, and it's so cool because it allows us to take Western diagnoses and
Yes.
provide more foundational kind of underlying support.
And I mean, also on the Western side of things, when we're studying a disease, some people don't respond. And that's when the Chinese medicine diagnoses come in, because if they're not responding, you're probably not treating the right presentation.
Yeah, or it might have made them worse. Sometimes when we use these herbs, and even in like Western herbalism, we dose very high for all these particular reasons, but maybe they get worse, or maybe it triggers other things in them that were like constitutional or heat related, or, you know, brought up other conditions with different properties. So it gives us a way to kind of balance that out for folks. So in Chinese medicine, it's been used for like febrile diseases, conditions we would call it at the blood level, which is just a diagnostic level in Chinese medicine. So nosebleeds, vomiting blood, like really blood coming out of anywhere that it shouldn't be coming out of, which, you know, UC is a good example of that. It's astringent and cooling. So if we think of people who are just kind of like leaking substances of whatever variety that are kind of hot, it helps to kind of astringe our tissues. It's also been used, which we'll get to, for a lot of skin conditions.
Oh, yeah. That data is amazing.
Totally. So boils, abscesses, folliculitis, what we will see.
We used to have that yellow powder that we would use. That's different than this.
That's different.
But those herbs are commonly used with Qing Dai.
Okay.
Yep.
In combination with? Okay.
In Chinese medicine, they formulate them together. Huangqin.
Maybe it was in that formula we had. I don't know.
The yellow, it was the yellow,
For patients with like, sorry, off topic, but I couldn't believe hidradenitis that there's like very little treatment for, you know?
Yep.
Anyway.
Yep.
And the yellow cream
They
worked.
would come,
pulls
like a
it
few
out.
people would come pick it up when they had a flare or a MRSA boil, and they didn't want to do it was relatively new onset. It wasn't going to go crazy. Talk about it another day. But yeah, it worked amazingly well for a few patients.
Topically.
Yeah,
it was like a
you
poultice.
guys had a whole video that we would have people, to make a
you're
poultice.
talking about the Jin Huangsan.
The yellow powder.
Yeah, the powder, not the one that was the poultice already. You make it into
No,
poultice.
they had to make
Oh,
it. They would
magical.
pick up the powder.
Yeah, magical.
That should be a medicine.
I have it at my clinic.
Oh, okay.
That's
That's,
true.
one of the few things you have because they need it right away.
Yeah, I bought it from. Okay.
Okay, that'll be another day, but that's
Yeah, we should talk about that. We should do like a whole Chinese herb survey and how we use it for. I mean, we have so much to cover on this. We're doing just one herb for this episode, but it does so much. It does so much. So back to what I was saying about how we can extract constituents from this. Indirubicin, which is a key active ingredient from Qing Dai, was studied as a treatment for leukemia.
That makes sense because we do use the main place in Chinese medicine we use Qing Dai is for cancer.
Oh.
Yeah.
Like there's a lot of huge cancer agent. Yeah.
Oral formulation.
Oral
or
formulation.
They made it into other.
Oral.
Yeah. And it does suppress immune response. So it's the Th1 to Th response. And then it does a bunch of other pathways we're kind of like learning about. In all, indigo is an anti-inflammatory, antioxidant, astringent, and modulates the immune system.
So is this one you wouldn't want to use for very long because it's cold forming?
So we're going to get, I bet we're going to get
Great
there.
question. There are a couple of reasons you might want to use it
Okay.
super long, but you can combine it with other herbs.
Okay.
Anyway, so for ulcerative colitis, I do have a bunch of studies, and I'm reading off my notes here, so I'm sure to cite things correctly. But we do have a bunch of studies kind of talking about it. But I also wanted to touch at some point on some of the dangers.
Let's start with uses, and then we'll start with risks. We'll go to risks.
Yep. Okay, so studies. One of the bigger ones was a multi-center, double-blind RCT in Japan. A lot of these are from Japan. Dosing at 0.5 to 2 grams per day for 8 weeks.
So 500 milligrams to 2,000 milligrams. That's important to know because usually the caps are 500 milligram caps.
Induced a dose-dependent response and remission in patients with active ulcerative colitis, with symptom reduction up to 81% and remission up to 55%.
Say that one more time.
Symptom clinical response, symptom improvement up to 81%, and then remission rates up to 55%.
I think
up to, meaning the higher the dose, the better it tended to perform.
I actually think I see it more effective than that in my practice.
Totally. And that I have 10 studies here, to kind of talk about. But this one was interesting because they did a post hoc analysis, which is basically where they'll go back and review the data after the fact for, things that they could extrapolate from it that weren't part of the original study design. So they went in and looked at that, and they found that this was effective even in treatment refractory ulcerative colitis.
For sure, I see that.
So people with steroid dependence,
For sure, I see that.
Constantly trying to shop around for ways to
Yeah.
help those folks.
Yep.
And folks who'd been using anti-TNF drugs like infliximab with mucosal healing, decreases in fecal calprotectin, and symptom reduction.
Yep. So histological and symptomatic improvement.
Amazing.
Yep.
Like, that's so cool. That one did have to be terminated, that study, because of one of the two kind of more serious things that can happen from this. And I'll go over all the data on like how often that happens and what you need to watch for and all of that. But this one was terminated due to pulmonary arterial hypertension.
Yep.
Oh.
I have never seen that, but I have definitely read that in literature.
The stats are low. I think it's
Yes.
like 1.2%.
That's what I found too.
Yeah, even in and that was just one population. So who knows? But, there are tons of other studies where they proceeded just fine, bigger studies, no safety issues, adverse effects, things like that. So there was another cool study that combined this with curcumin, which temperature-wise is hot or cold?
Hot.
Hot. So it kind of balances this out a little bit. Qing Dai is very, very cool.
Very cold. Yep.
Curcumin is very, very warm. So, kind of blending that together from a Chinese medicine perspective might be easier on the body, depending on what's going on. But this was a retrospective multi-center cohort study in 2023 that found that combo induced clinical and biomarker remission, meaning I don't remember which biomarkers it was, but I'm going to guess like CRP, calprotectin, things we can use, in 46.5% of people, including those with prior failure of biologic treatments. No significant adverse effects in that study. So, I mean, those aren't bad numbers, especially for something that's relatively affordable compared to biologics in people. We have, let me see here. What are the ones that are really interesting? So they went on to kind of study how this is working, because we know in Chinese medicine sort of theory, and I think that's what sort of birthed these studies, is we see it cover a bunch of the bases that we see in ulcerative colitis, like the heat, the bleeding, all of that. But how would we explain that in Western medicine? So one thing that was kind of cool is they did do a microbiome study.
Okay, cool. This is new to me. I haven't heard this.
This is animals. This is animals in a journal called Molecules, which I've never heard of.
Okay.
It's a really cool journal. It's a 2019 study. Animal models, not humans, how Qing Dai alters the gut microbiome. So what they found is that it increases our beneficial anaerobic gram-positive bacteria and reduced a broad spectrum of pathogenic bacteria. So a lot of us, when we're treating any form of IBD, but ulcerative colitis included, we're also looking at the microbiome as a way to kind of help reduce inflammation overall, reduce triggers, get people out of a flare, prevent people from going into a flare. And this kind of does both. So it's not only helping on the microbiome level, it's helping, quell the flare from inflammation and all of that. They then took this data and put it into something called functional metagenomic predictions, which I'm just going to assume is fancy math.
Yeah, or AI. Yeah.
It was 2019. But yeah, fancy math computer stuff. Suggested that indigo may help maintain microbiome homeostasis during colitis flares. So that's cool because, we definitely mess up the microbiome in treatment. Even our big drugs, steroids, all of that, yes, they work. Yes, we need them sometimes, and they're not without the repercussions. Right. We need them we need those bugs, and we do a lot of work on the back end to kind of help after those treatments or during those treatments. Qing Dai does it all. So that's kind of a summary of the studies. There are tons more, but those are kind of the heavy hitters. The stats kind of vary, obviously, person to person. There was only one I could find that actually got pulled because of adverse effects.
Just one study.
Yep. There were reported cases of the other things we'll talk about, intussusception. The main thing that we see is the mildly elevated liver enzymes. None of those had to stop studies for safety concerns. It was just that one.
Yes.
And we have short duration, long duration, 2-week course, 8-week course, but they're all, in that around 50 plus range efficacy.
I feel like if you ask me what I see in clinical practice, I am probably at about 89, 90% efficacy.
Totally.
It is ulcerative colitis went from being this very, very difficult thing to treat to not always, but often smooth sailing. Yeah. But I do have a subset of patients who cannot tolerate it. Because they get nauseous, abdominal pain, worse diarrhea. And then I have a certain subset of patients that can tolerate it, but at micro dosing, 150 to 200 milligrams. which, we're using 2000 milligrams. I've
In
gone
acute
as
flares.
in acute flares. I've gone as high as 1500 milligrams twice daily for a small subset of people. And there are some people that literally an eighth of a teaspoon.
Yeah.
Yeah. Bodies are different.
Bodies are different.
But it is a really helpful tool. And all these studies were oral administration. We're not just using it orally.
Should we finish up side effects
Sure.
of
And then
oral
talk about
administration, and then we can talk about other utilizations of it.
So as I mentioned, the severe complications we'll get to, the more common stuff, and it's not that common, are the elevated liver enzymes. Mm-hmm. So a lot of us will just check liver enzymes like as part of our annual screening anyway, as a metabolic panel or something like that. Make sure we're not sending people in with already elevated liver enzymes.
Which we're doing before we start any kind of big treatment protocol either way.
But like fluconazole can do that.
Yes, exactly.
A lot of things we give all the time can do this. Yeah. This can also do that. So, know that for certain populations. The very rare but severe complications are intussusception and pulmonary arterial hypertension.
Yes.
Which, no joke. Those are no joke.
So I will say one of the things that patients who use Indigo Naturalis have to be aware of is if they walk into the emergency room and they tell the clinician that they are on Indigo Naturalis or Qing Dai, the clinician is going to do their due diligence immediately and do a literature search. And the thing that's going to pop up is portal arterial hypertension. Yep. So it's pulmonary hypertension
or intussusception.
I mean, I think that where ER docs get more concerned is the pulmonary hypertension. Yeah, that is going to come up. So they just need to be educated about that and also educate the clinician about that it is a possibility. Yeah. Do you have stats on how often it comes? I have it off the top of my head, but I want to make sure I'm giving correct stats.
Yeah. So the intussusception was, 10 cases they found in one study where nearly 50,000 people were studied. So pretty low. I don't know the math on that.
Yeah, and it's like, how do you even know it's from that?
Well, when I did review it, there were no underlying anatomical or predisposing causes in that population they studied for that one study. What they were kind of attributing, and it got better after people who didn't need surgery, which was 40% of that subset of people, so 4 out of the 10 people. It improved in all cases when they got off the Qing Dai.
But if it's bad, it could be a surgical emergency.
Yeah.
Yeah, it's serious.
People out of 50,000 did need surgery.
Right.
They were attributing it to the poor water solubility of Qing Dai. Yeah. So, drink water.
Yeah.
Is a good idea for everyone. And maybe, think about that if we're going to be giving it ways to kind of support water staying in the gut and moving the bowels. And, all of that is really important stuff. Or the way that Qing Dai can alter gut motility, microbiome, mucosal integrity, things like that. So we don't know. Pulmonary arterial hypertension was in studies housed in Japan in both adults and pediatrics, 1.2%.
Yes.
At a dose of 1 to 2 grams per day.
Yes. That is absolutely the data that I saw.
And this occurred weeks after initiating therapy. So it wasn't like an acute reaction. And that's important for us monitoring, that would be something that would appear after weeks of doing it.
And so, monitoring blood pressure, monitoring liver enzymes. Yeah. I monitor liver enzymes every 3 months from baseline. Yeah. And I've definitely seen them a little bit trend up.
But not that triple the threshold alarm bells.
No, I had a patient come in and actually just 2 weeks ago, I had a patient came in. Her AST was 12, her ALT was 14. We tested, she's very cautious. So we tested 4 weeks later. Her ALT went up to 20, her AST went up to 22. But that's still an increase from baseline. Right. Was that caused by the indigo? Definitely, maybe.
Yeah. But
also not concerning.
But also not concerning. And with all fairness, for her, she was so severe. Yeah. And the indigo got her out of that severity. She was so 25 bloody bowel movements a day. Just all of a sudden, her fire raged. And then with the Indigo Naturalis, within a week, she was down to 4 bowel movements a day. But there's a cost to it, possibly. Yeah. It's one of our more risky natural interventions.
Because we dose it high. A lot of, you have to dose herbs high to do high things. Yeah. A lot of our herbs we can get away with middle ground, or we can layer in different herbs, lower dose, but a bunch of them. This is one that just shows efficacy when we dose it really high.
Yeah.
You just have to watch out. But compared to the potential adverse effects of influenza,
there's something there's nothing left to try.
Exactly.
I think it really does. It really depends on your comfort level. I had a doc, pediatric gastro, come in and do an observation day with me, right? And I'm telling her this is a magical treatment because the conventional world is very frustrated with ulcerative colitis. Yeah. And I was it's like now at this point, so much easier for me to treat. It's still a complicated condition, but it's so much easier. But she felt very uncomfortable with the potential risks because it's not in the standard of care.
Yeah.
So you're more likely to have a comfort level of navigating it, working with a functional medicine or naturopathic provider than you are with a conventional doc, because it's just not in their.
It's not an FDA approved drug or anything.
So we don't have massive studies, even though we have a lot of studies.
We do have studies, and recent. These aren't from like the 1960s.
Drug in Japan?
That's a great question.
Okay.
But have they formulated it as like?
I don't know.
And in China, they use it routinely?
Yes. They use it routinely for this condition. They use it a lot for cancer treatments. So then
I will say though, for the hypertension cases, nearly everyone got completely fine. It resolved as soon as they stopped taking it.
Yeah, that's what I've noticed too.
So that does, suggest a correlation, potentially causation there. Stop it.
Does China have an herbal formulary that doctors use?
Massive, it's actually, when it was like blooming at its best, or when you could see the efficacy of it, is during COVID. Okay. They have a National Institute of Health that manages Chinese herbal medicine. They were coming out, they were updating their herbal protocols during COVID, like basically live every week to 2 weeks. And so all patients were getting herbal teas plus pharmaceuticals. And back in COVID early days, nobody knew what the hell it was.
Right. So all of their doctors are trained to prescribe.
No, but they have doctors who are trained in Chinese medicine.
I shadowed at yellow people all around with infectious disease, like various liver conditions. But they'd have the doctors come in just like rounds. Yeah. And it would be like the Chinese herbs, the acupuncturists, the conventional
so they still have different, it's not the one person.
Yeah, no, you go to different medical schools, but they're all part of like the team, just like we have here. We just don't have that. And then there are hospital wings that have all the Chinese herbs. Just like they have pharmacies, in hospitals, they would have a Chinese pharmacy as well. It was so cool. It was so cool.
And they just brew the teas and bring the teas to the patient.
Yep.
And it's usually teas more than powders.
Yep. And it smells bad.
Chinese, not bad, just Chinese.
But it was so cool to see. I was like, this is amazing. What if we have something like this here?
Which is why if you're looking at data that is coming out of the integrative space, Chinese herbal formulations is like light years ahead of any other intervention.
And it is thousands of years of trial and error and studying and meticulous documenting.
Yes.
Like they learned the human body.
Yes.
And the patterns in the human body and how it interacted with nature.
Yes.
It's insane.
And
so impressive.
The reality is that conventional medicine works very well for a subset of people.
Yep.
You don't need anything else for a certain subset of people. But lots of patients fall through the cracks, which kind of keeps us employed because the body is not just physical. And that's what Chinese medicine understands. That's what Ayurvedic medicine understands. That, the body is complex and energetic. And to get health, you need to target all of these aspects of it, the physical and the energetic.
Totally. And even if the drugs do work, what are you left with? Like, are you just going to be back to square one in 6 months or a year the next time you get a virus? Like, how can we help build the system up for resilience and strength?
And as a clinician in a state with a lot of licensure, I am also exceptionally grateful for some of the conventional interventions some of the time.
What if we did both? Like, that's what we do.
Yeah.
What if we did both? Oh, it's amazing. You got to go to school for a lot of stuff.
A lot of years. Or have a really good team.
But the other thing I wanted to mention that isn't really an adverse effect, but we do inform our patients of, is this turns your colon
blue.
So when you're giving it orally for folks, how long do you tell them to stop it before like a colonoscopy, let's say?
I don't. And I have a lot of patients on it and I have never seen the report of a blue colon in my clinical expertise.
Being a dive.
Yes. I've never seen it.
No gastros?
No. All of my gastros know that their patients are on it. Yep. I am yet to see a report that says the intestine is blue.
Turmeric?
Never had an issue with that either.
Amazing, because that dies. Spill out on your...
Yeah, no. Apparently the intestine is more hardy than your counter.
Amazing. Yeah.
Maybe it washes out by the time they do the prep.
I mean, the prep washes out everything.
Yeah,
that is true.
Yeah.
I feel like someone would have told you. I feel like someone would have told you or given you that feedback that, the GI doctor told me my colon.
Right, exactly. I read all of those reports. Yeah. Any other side effects that we need to know about?
That's it. That's like all that's been documented, those three. So, some would expect the liver enzymes.
Watch it.
Just watch it. And then the other things, like knock on my couch here, I've never seen that, but we should inform people about it.
Well, I have one of my colleagues had a patient who potentially had an intussusception case. So I've heard of it from one of my colleagues. I've heard of one, and it resolved spontaneously, just like it forms spontaneously. Okay, so one of the ways
After stopping it?
after stopping it, yeah.
Okay.
One of the ways that I think, using my Chinese medicine knowledge, that I am decreasing possible side effects is, in Chinese medicine, like Dr. Sand was saying, we never use single herbs. That's just really not done in Chinese medicine. In Chinese medicine, we put together these really beautiful orchestra formularies with this one that's cold and this one that neutralizes and this one that keeps it in the middle and this one that, sends it to the bladder or whatever. So whenever I am giving indigo naturalis, I am always pairing it with another Chinese herb called shengjiang or fresh ginger. So it's dried fresh ginger. There's also a different herb called paojiang, which is dry ginger, which is too hot, right? That's you like fry it to dry it. So this is just dehydrated ginger. Ginger is a warming herb. Like if you have ginger, it makes you feel
Ginger's
warm,
hot, yeah.
right? And it keeps it in the middle. So it prevents it from going, in my Chinese medicine knowledge, prevents it from going to the liver or leaving the bowels.
So in the middle, in Chinese medicine, our eyes treat based on the three categories of where things are kind of stuck. So that one keeps it here rather than going elsewhere in the body, which sometimes we need.
Right.
This one you see, right in the middle.
And what I will tell, the other thing I tell patients when they're on this herb, and even this combination is, these patients are usually having hot, bloody diarrhea, 5, 10, 20 bowel movements a day. Some bowel movements are just mucus and blood. It's hot. There's a fire in there, right? Qing Dai is cold. So you take it, and what happens is nothing. And then the bowel movements start forming up. And then all of a sudden you might pop into diarrhea again. But it's a cold diarrhea. There's no blood. It just falls out of you. It's a cold diarrhea. When that happens, I want to back off the Qing Dai because now I've made your intestine cold. And so now I think I've healed up all of those ulcers that were in there that were causing the problem. So then now we back off the indigo. Most people, when they use indigo, they are using it for a small subset of time, like 1 to 3 months. I do have patients who use a very small dose for a prolonged amount of time. I am always monitoring their liver enzymes. And if we're honest, I don't know if it's doing anything. I think they're just more a little bit superstitious.
Even like a half-dose oral pills. Yeah. Once the calprotectin's down, you see that flip in the bowel movement.
Yep. And the minute they start feeling bad, they just jack up their dose. They're very educated on how to do that.
I haven't seen the low dose affect liver enzymes, have you?
No, but I'm always checking.
High dose.
Yeah.
Again, it's not super common. It just can happen.
I'm always checking. It's a good formulation. The other place where I am oftentimes using it is rectally. Yeah. I will have my patients suppositories. Yeah. I will make my patients. Yep. I teach them how to make it at home. And I have, indigo in there. I don't have any ginger in the rectal because that's me. But I have a couple of other natural agents. Yes. Yeah. I mean, some other things in there that works really well for proctitis, but also for fissures, anal fissures. Yeah. Because fissures are basically exactly what's happening with UC, but in the rectum where we can get to it.
Irritation, pain, angry tissue.
No one makes that as a suppository.
No. I know.
Every time I go to a farmer's market, I find the herbalist and I'm like, are you growing indigo? What are you making with it? Because I also use it for psoriasis.
Let's talk about that. Do you have any data on that?
Yeah.
Psoriasis is the other place where it has a lot of clinical trials.
Yeah. So when they've studied it, it has shown significant efficacy in most RCTs, with over half of treated patients achieving at least 75% improvement. Wow.
This is a topical administration.
Yeah, topical administration. This has 0 side effects.
That's crazy.
I couldn't even find rash.
It might dye your clothes blue. Let's be honest, Rebecca.
You apply it as
Zap.
Mix it with water or.
Yeah. I mean, you can get a powder and put it in something, a base or something. And it works even better according to these studies if you combine it with other therapies. So other ones we might use are like coal tar. We have tons of prescription compounded
topicals. Yeah.
So you can use it alone or combine it.
Put it on and leave it on for an hour or two.
At bedtime.
Whatever you can get away with.
Yeah. You can't lay down with it on.
Sure you can. I mean, you have to be not.
Your clothing.
Yeah, don't be attached.
Put, gauze over it.
Okay.
You don't want it you want it to breathe. A little
so
bit,
is psoriasis seen as a hot condition in Chinese medicine?
Yeah.
The lesions are going to be hot. Yeah. They're red, they're yellow, they're pustulely, they bleed, yes.
Yeah. Pussing, hot, red.
Yes.
Yeah. I mean, it's inflamed.
It's inflamed. I guess I just think of it differently than an acute.
Yes.
Yeah.
Yes.
It's also potentially not microbiome. I mean, your skin microbiome related. So it's helping from
Yeah.
an antimicrobial perspective
Yeah.
as well for folks, fungal or whatever. What they're thinking the mechanism of action is for psoriasis is the main active components, which are indigo, indorubicin, which we talked about for leukemia, and tryptanthrine. I've never heard of that one.
Say it with confidence.
I don't know. Demonstrate anti-proliferative and anti-inflammatory effects. So specific to the Th17 pathway, which, we know about in psoriasis. So well tolerated, slap it on your skin. The issue for me is finding it. So every once in a while,
I have some sources on Amazon.
they just change.
I know.
They change.
You don't have the local place anymore?
They don't make salves. I have a local Chinese compounding pharmacy here
Yeah.
that
So you
makes
can
the
make your own.
herbs. Yeah.
Yeah, you can. It's flavor intensive for
Yeah.
folks. There was a really good product at a local store that was on the street of the clinic I work at for a while. It was awesome, but they stopped selling it as well. So, and I know locally, like very close to us, there are indigo farms. People are growing this. I know. That's why I'm like, can you just make me a
Interesting.
stack? I'll sell you out, but they teach like indigo dyeing classes and things like that.
Huh.
Also cool. Get it on your skin if you have psoriasis.
Cool. I never
Yeah.
knew that.
And I'd love like a shampoo, or something like
They
that.
use
Like,
it in henna.
yeah.
Oh, they do?
I think so.
If we,
The blue
could get
henna.
if we could get like a shampoo.
There's a blue henna?
I mean, I don't use it, but they sell one.
Huh.
If you want your grays to turn blue.
Yeah.
Cool.
That would make me punk rock.
Love that. Love
Yeah,
that.
it was, I will definitely say it is a very, very useful tool. Like if you don't believe in herbal medicine or natural medicine and you have a need for this herb, it will convert you like that.
Yeah.
It is that effective not for everybody, but for a lot of people.
One thing I wanted to ask you about is for fistulas.
Yes.
So I know, in our spare time, we've kind of talked about ozone suppositories for fistulas,
Spoiler alert, an episode's coming.
Yep, we're going to do an episode on ozone up the bum. But how are you using it for fistulas, the suppositories specifically?
So, fistulas are not so simple as like fistulas come down to where they are.
Yeah.
And so if it's a vaginal rectal,
Yeah.
I'll go intrarectal.
Okay.
If it's
To try to keep the bacteria load down?
and to try to close it up.
Yeah.
Yeah.
Have you actually seen it close up?
Fistulas from Qing Dai, I'm never doing just one thing. But yes, for my treatments, yes, I absolutely have. Yes, absolutely. Can I rely on it? No, they put in cetons. They give them antibiotics. No, cetons. It's basically like the best way I can describe it is, when you used to do lanyards with like the plastic, it's like that type of consistency that they put into the fistula to make sure it remains open. No. It's like literally a string.
To keep it open?
To keep it open so that your problem with the fistula is the fistula, but it's also when it closes up, then it becomes an abscess. So you need to keep it open, and people will have cetons for the rest of their lives.
If it stays.
If it continues to close up and turn into an abscess, they put in cetons, and that keeps it open to prevent that.
Or they try to surgically correct it.
Surgically correct it.
It's very hard to do.
Let's do an episode on fistulas.
Okay.
Yeah, let's do an episode on fistulas. There's enough information here that I have that's really good to know.
Yeah,
Great.
Those are a bummer for people.
Literally.
Anyway, maybe consider Qing Dai for that, but more to come.
Okay. Could we recap?
Yeah.
Ami, do you want to do the recap?
Sure. So Qing Dai is an herb that is really effective for ulcerative colitis, topically for psoriasis, low risk of side effects, but potentially look out for pulmonary hypertension, elevated LFTs, the colon turning blue, but you've never seen it. It's very rarely interception.
Yeah.
Right? It had 50% plus efficacy for UC flares, which I don't know if any of the medications have that.
No, they don't. They're at about 30.
Including in refractory cases.
Efficacy in refractory cases. Yeah.
All right.
Yeah, and put it on your skin. Get psoriasis.
Great.
Cool.
Thanks, guys. Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.